Hello and welcome to LociMania, ARDS. Today we're going to talk about this adult respiratory distress syndrome, also called hyaline membrane disease. And we're going to start off with the definition. The definition is a condition with inflammation in the lungs. And you can see it by hypoxemia, and there's fluid accumulation, so pulmonary edema, and a hyaline membrane is formed around the alveoli, and then you have your immune system coming to the site, and ironically to help out, but usually they do more damage than help. And that's the neutrophils, and this is all caused by problems of the surfactants. So the pneumotypes type 2 diminish the production of surfactants, and this is how the fluid accumulates, and you have problem with the gas exchange. So symptoms: you have SOB, shortness of breath, hyperventilation, so a rapid shallow breathing, and low blood pressure is also one of the symptoms. And you can see cyanosis, so bluish color on the lips or at the tip of your nails, and that's it. So let's move on to the next slide. So the next slide is causes. There's many causes to this disease. It happens usually to patients that are very sick and already in the hospital. But you can see infarction, shock, trauma, sepsis. So this are some of the causes. I have a better picture right here. The ARDS. It's a mnemonic for you to remember. So first of all, you have aspiration, because that's what you need to do. Radiation, drug overdose, and shock. So let's start from the beginning with the ARDS. A for aspiration, and it happens usually with acute pancreatitis. Then you have R for radiation, D for drug overdose and drowning, and also S for shock, sepsis, and smoke inhalation. So these are this are a mnemonic for you to remember. Good one. And let's move on to the diagnosis and treatment. So when we come to diagnosis of this disease, you need to rule out the differential diagnosis. So you do a chest X-ray to check the airways, as well as check how much fluid there is in the lungs and if your heart is enlarged. You can also do a CT scan to get a better picture of it. So lab tests the oxygen levels. You try to see any signs of infection or anemia. And then ECG and echocardiogram to rule out any cardiac problems with this patient. When you come to the treatments, first of all, you do a oxygen supplementation for the patient, because this patient is already having trouble breathing on his own. So help the patient to breathe. Later on, you need to maintain the fluids. It's very important, because this patient has problems with having fluid in the right areas of his body. So you need to maybe give the patient some diuretics or any other ways to maintain the fluid, so it's not over more than what he needs. And treat possible infections with antibiotics, of course. If this patient went through a sepsis, shock, or something with a bacterial infection, you need to give him any kind of antibiotics to help this patient. And usually also you do relieve pain with painkillers, prevent clots in the legs and lungs, and minimize the gastric reflux. So these are like alternative and side medications you give to these patients. Thank you very much.